Are you one of the 8 of 10 Americans that suffer with severe low back pain at some point in their life? I'm going to show you a couple of reasons why you might be having that pain and what you can do specifically to address it when it does occur and how to prevent it from occurring. Hi, I'm Dr. David Bertone, board certified orthopedic clinical specialist and licensed physical therapist practicing in the Lincroft area with over 30 years of experience. Let me tell you about some of the reasons why you might be suffering from low back pain. First of all, our bodies were not meant to sit all day and be rounded like that, which most of us do on a daily basis. How many people actually bend backwards during the day and take some of the stress off of their spine? So that rounded position of the spine puts a lot of strain on the structures on the posterior or back portion of your spine. The spine was meant and designed to have a little hollow there, so most of the things you do, you should try to maintain that position. Now, why are you having back pain in this particular region? Well, there's really thick ligaments that go across here that support the pelvis to the sacrum and to your low back. And sometimes as the stress occurs in this region, those ligaments can be irritated. 99% of the time, the muscular pain that you have is not resulting from muscle injury. It's very rare to be muscle injury. It's usually some underlying problem, either discogenic, some irritation of the disc, could be coming from irritation of the joint, irritation of the spinal nerves, or irritation of those ligaments that we talked about, but never muscle injury. The muscle spasms and protects to avoid movement and stress to those structures that have been irritated. Let me show you some things you can do to prevent that problem from occurring in the first place. So at some point during the day, you want to spend some time taking the stress off your low back by just laying on your belly, up on your elbows, and just letting that natural hollow in your low back return to its natural position. And you can do this at the end of your workday or during the day to take some pressure off. You also want to try to encourage some gentle extension of your spine to eliminate the cumulative effect of that slump rounded position. This should not cause any pain, just relieve some of the tissue tightness that may be developing. If anything causes pain, you need to stop immediately and let your doctor or physical therapist know. You can also start firing some of your abdominal muscles by being in this position and just tightening your belly, letting it sag. Tighten your belly, letting it sag. And you can even get some motion in your spine by rounding and extending to really get that spine to have good mobility in there without being locked in any position. These are preventative things that you can do on a daily basis to reduce the chance of developing that acute low back pain or spasm. Lastly, you want to periodically during the day just gently bend backwards. If your low back pain doesn't resolve after 3 days, call us at DB Orthopedic Physical Therapy. We have offices in Lincroft and Manalapan, and one of our doctors of physical therapy, highly trained in the treatment of low back pain, can help resolve your problem now.